Hello, Maryann and Rema. Thank you so much for offering this incredible opportunity for our Wayne State University students. My name is Mariana. I am the event spokesperson for Club Med Virtual. I will be leading today's session, reading any comments posted in the chat, and facilitating the conversation as we go along. Before we start, I want to remind everyone to maintain proper etiquette and please keep themselves on mute unless Rema and Maryann specify otherwise. If you have any questions, please post them in the chat and we will address them as we proceed through the session. A Google survey will be administered for Wayne State University students at the very end of the session to verify your attendance and will close 30 minutes after the session terminates. Please stay on the call for at least 5 minutes after the session is over to ensure that the survey is working for you. The session will also be posted on YouTube in case you are unable to attend or want to revisit certain topics Rema or Maryann discusses today. But you cannot receive shadow or attendance hours if you're not present in this call and complete the survey. All right, Maryann and Rema, you guys can get started. I want to thank you guys again because I know it's like busy time for you guys.
Of course. Okay, I'm gonna get started. Okay, guys, so we're gonna do a case study today about orbital fractures. And you guys can all see my screen, right? Just to double check.
Yeah, we can see it.
Yeah. Okay. Okay, so just to give you a little background information about ourselves. So I'm Maryann Robin. I'm a second-year optometry student. I graduated from Oakland University in Michigan with a Bachelor's of Science in Biology. I worked in the optometric field for about 5 years before going to optometry school, and then I started optometry school at Midwestern University, Chicago College of Optometry in the fall of 2019. So I'm a second year.
Okay. And I'm Rema Idriss. I grew up in Omaha, Nebraska. I went to undergrad in Nebraska. I actually was a pre-med student. I decided on optometry very last minute. So I had no optometry experience going in. I actually took the MCAT. So I thought I was going to go to med school, but changed my mind very last minute. Started at Midwestern 2017, and I only have 6 months left, graduating in May.
Lucky. I wish I had 6 months left. Okay, let's go next. So we're just going to talk about optometry school a little bit. So optometry school is a 4-year program, just like any other professional medical school. Our first and second year are mostly like studying and learning all the clinical skills, and then third year is like half in classes and half in the clinic, and then fourth year is all rotations. But it's not about studying, it's also about having fun. So as you can see here, like we have a lot of fun in optometry school. We meet a lot of people. You meet people from like literally all over the United States. We have some people from Canada too in our class. So it's really fun, but it's really hard too at the same time. Do you want to add anything, Rema?
No, I agree with everything that you said.
Okay. I know Midwestern, they focus more on like the clinical skills. So we learn a lot of clinical skills, especially like literally our first week of classes, I think we started our clinical skills. So I do know like other schools don't do that. So that's always something to look for when you're applying to optometry school, is like what is their curriculum like, you know? Okay, so let's go next. Okay, so I want to talk a little bit about ocular anatomy before we get into the actual case study. So for this case study, we're going to be talking about orbital fractures. So I wanted to give you some background information about like the bones of the orbit and the extraocular muscles. So first, if you watched my previous session with Club Med Virtual, you'd know that I already went over the eye anatomy. For this one, I don't think we really need to go in depth on anything of the eye anatomy, but it's here just in case you want to look at it. So for the EOMs, the extraocular muscles, we have the lateral rectus is right here. The medial rectus is right there. Can you guys see my mouse? You can, right?
Yeah.
Yeah. The superior rectus is up here, and then the inferior rectus is down here. And then if you look on the side, you also have the superior oblique, which is held by the trochlea right here. And then you have the inferior rectus too. So those are the 6 extraocular muscles that are really important, that they help move the eye. So we need to know that for sure. And then we have the bone of the orbit. So the eye is called, so we call the eye the globe, and that sits in the orbit. So this is the orbit right here. And it's made up of these bones. So we have the lacrimal bone right here. And then we have the palatine bone, is a small one right in here. You have the greater wing of the sphenoid. And then this is the lesser wing of the sphenoid. And this. And we have the frontal bone is right here. The zygomatic bone is right there. And which else? Oh, and the maxilla is right here, the purple one. And I think that's all. Did I get all of them, Rema?
And I think it's on one of the next slides, maybe.
Yeah, I think we talk about it again too. But I just wanted to give a visual presentation about it too, okay? So now, okay, so this is what we're covering today. Do you want to start this off, Rema?
Yeah, so like Maryann said, we're just going to talk about orbital fractures. She'll go over the anatomy of the orbit again with you guys. I'll talk about the pathophysiology, some clinical signs and symptoms that you want to look for if someone comes in with an orbital fracture, some differentials, and then Maryann will go over the treatment and management.
Okay. And then also, we also wanted to show you guys like how we study for classes too, so that's why we have this written on here, just so you know. Okay. Do you want to say anything about this, Rema?
Yeah, so before we get started, I just wanted you guys to imagine that you're in clinic in optometry school during 3rd year and someone walks in looking like that and they just tell you they were just in a fight and now they see double of everything. They see 2 of everything. What would you do?
Okay, so again, we're going to look at the anatomy of the orbit. So the orbit is contains the globe, which is the eye, and the extraocular muscles, the optic nerve, and other small nerves, connective tissue, and adipose tissue, so that it can hold the eye up where it's supposed to be. You have 7 bones that form it. It's the frontal, sphenoid, ethmoid, palatine, lacrimal, zygomatic, and maxillary. And then this is one way to memorize all of the 7 bones that we came up with, or that Rema came up with. And so you need to know like all of the bones on every side of the orbit. So we have the superior orbital wall, so that's going to be the top. That is formed by the frontal bone and the lesser wing of the sphenoid. So here you can see for the roof, we say front less. That's how we memorize those 2. And then you also have the supraorbital notch. In the lateral orbit wall, you have the zygomatic bone and the greater wing of the sphenoid. So the lateral, you have the great Z. The orbital floor is the maxillary, palatine, and zygomatic, and that's and also the infraorbital groove. And then the medial orbit wall is the maxillary, lacrimal, ethmoid, and body of the sphenoid. And you also have the lamina papyracea. And then that one is smell. And I think, all of these have the sphenoid except for the floor of the orbit. Did you want to add anything there, Rema, or no?
Oh, that's perfect. No.
Do you want to start, Rema?
Yeah. So you have the orbital rim that protects the eyeball and it's supposed to absorb shock. But sometimes that force is too much and it can fracture the bones, and that's how you get an orbital fracture. You can either get a blow-in fracture or a blowout fracture, and I'll talk about the difference, I think, on the next slide. Some injuries that are associated with orbital fractures is if you have a ruptured globe, if you see a hemorrhage behind the eye, if you see a hemorrhage in the jelly part of the eye, the vitreous, if you see a hyphema or blood cells accumulating in the anterior chamber, if you see a dislocated lens. Sometimes orbital fractures can cause secondary glaucoma, and that can raise the pressures in the eye. They can also cause retinal detachments. All right, so we have two different theories that I'll talk about. You can get an orbital fracture from an indirect injury or a direct injury. If it's an indirect injury, it's when you get a blow to the orbital rim, and that force transmits to the orbital walls, and that's how you get the fracture, and that's called the buckling theory. The other theory is when you get a direct injury and you get a sudden compression of the globe, and you fracture the floor of the orbit. Some clinical signs and symptoms that you want to look for. Periorbital ecchymosis means we call it the raccoon eye, and that's when blood cells accumulate around the orbit, so periorbital around the orbit. If you go and check the eye muscle movement and you see impaired extraocular muscle movement, that can tell you they probably have a fracture. Hyposthesia underneath the lower lid, and that's where the infraorbital nerve is. Intraorbital emphysema, and that's when you get air cells underneath the tissue, or if they have a subconjunctival bleeding. Some symptoms that they can complain of is double vision or pain on eye movement. So this is a differential of orbital fractures. It's called a superorbital fissure syndrome. And the superorbital fissure has the 3rd, 4th, 6th, and some branches of cranial nerve 5. And this happens when there is an increase in the intraorbital pressure, and that can compress the nerves in the superorbital fissure, and it can cause paresis of the nerves, and it can cause a deficit in the eye movement.
Do you want me to play this video?
Yeah, go ahead. Okay. So like I said, that can cause a paresis of these nerves, and the extraocular muscles will undergo paralysis, so the eyeball cannot move. And then you get double vision because the visual axis or the axes are not aligned. A blow-in fracture, so you can either get a blowout fracture or blow-in fracture, and this happens when you get fragmented bones of the floor that get displaced in the orbit, and that can cause proptosis or bulging of the eyeball, and this is common in fractures of the orbital floor.
And then I'm gonna play this video too, so you guys can see how her eyes are like popping out.
আঙ্গুলের দিকে তাকান আবার দেখুন
A blowout fracture happens when there's an increase in size of the orbit, so the eyeball sinks, and that's called an ophthalmos. Another differential diagnosis that you can think about is called carotid cavernous fistula. The cavernous sinus is located behind the orbit and it receives blood from the orbit. But this condition is basically happens when there's an abnormal connection between the carotid and the cavernous sinus, and it can be idiopathic, so we don't know the cause, or it can happen from penetrating trauma. But these patients usually present with similar symptoms of an orbital fracture. And those symptoms can be like double vision, proptosis, or bulging of the eye. And to differentiate it, you can do a CT scan or MRI. Orbital cellulitis is an infection of the soft tissue of the orbit behind the septum. And these patients may present with similar symptoms like double vision. They can have pain, fever, and usually differentiate it by doing a CT scan as well. All right, Maryann, if you want to go over the management.
Yeah. Okay, so let's say the patient comes into your office with an orbital fracture. What are you going to do? So first you're going to do the periorbital examination. So you're just going to check the around the orbit to see how it looks. You're going to check the visual acuity to see if the patient's vision has changed. You're going to check for crepitus. So that's like if you touch the patient's face and see if you hear a noise, that means like the bones are like cracking. You're going to do a slit lamp exam, which I talked about in my previous presentation, but that's basically just so that you can check the health of the eye. You're going to do ocular motility testing, so you're going to see how the eye is moving, so if it's moving or if it's not moving. And you can do a forceduction test where you take a pair of like forceps and you like just kind of squeeze the eye a little bit and like try to move it yourself. And if you can't, then you know that something's wrong. Pupillary response, you want to check the pupil size, the shape, the symmetry, and the reactivity to light. You're going to check visual fields to see if they can see anything like on the sides. You're going to do tonometry, so that is how you check the pressure of the eye, so the intraocular pressure. And then you're also going to do Hertel ophthalmometry, which measures how much the eye is coming out of the head compared to the other eye. And then you're going to send them out for CT scan or MRI to visualize what the fragmented bony structures, so just to see like what actually is going on in there. So you're gonna recommend ice packs to reduce the swelling. You're gonna give them antibiotics and decongestants if they need it. You're gonna ask the patient not to blow their nose for several weeks, and that's because you can get an infection up to your eye if you blow your nose, especially if you have a blowout fracture in the floor of the orbit, because you have the maxillary sinus right over there. You're going to refer to an oculoplastic surgeon, and then the treatment with surgery is not needed if the fracture is small. I think it just goes back to normal by itself, right, Rema?
Yeah, it heals on its own if it's small. Mm-hmm.
Do you want to do this one?
Yeah. So when would you recommend surgery? If they have double vision that's not resolving, if they have an ophthalmos that's greater than 2 millimeters, and if you do a CT scan and you see a large fracture, then you want to do surgery. Recovery timeline, these patients usually stay in the hospital overnight. They're usually put on antibiotics, steroids, and some NSAIDs for a week, and use ice packs as well. They should also avoid strenuous activity for 2 to 3 weeks after surgery. So most people recover well. Double vision may last for as long as 2 months after surgery, so that's something to talk to the patients about. And sometimes we prescribe something called Prism to correct for the double vision. Is that all we have? Oh yeah, and to prevent orbital fractures, you always want to recommend wearing protective eyewear.
Yeah.
And I think that's all we have.
Okay, so I guess we're gonna do question and answer now.
So you guys can either unmute yourselves or post in the chat. Sorry to see that Anna Wren asked, is Prism glasses?
Yeah, so we can put Prism in the glasses to shift the image so that they don't see double.
I'll just leave it on this side while we answer questions.
Sure. So I actually have a question. I saw that you both were on the optometry private practice club, and I was wondering if you guys could go into the work that you did.
You can start, Maryann.
I was like, you can talk about it. I was just a member, so I would just go to the meetings that were held, and it was fun. We saw like a lot of people that were private practice owners. I want to hopefully open a practice of my own one day. So hear like their stories and like their tips on like what to do, like to open a practice or to not, and how to deal with it.
Yeah,
I can tell you more about it.
Yeah, so I actually started the optometry private practice club 3 years ago, and I stayed on the board for 4 years ago, and I stayed on the board for 3 years. But yeah, we just brought speakers from all over the states, and they most of them owned the practice, and they just talked about how to become a successful eye doctor. I know all of the schools teach us how to do well in school and how to become good doctors, but I feel like the private practice club really helped me learn how to become a successful doctor.
Mm-hmm.
Awesome.
Agreed.
Question from Aya. She said, can you talk about some study skills for graduate level exams?
Okay, well, okay, well, so in undergrad, how I would study was I would write out all my notes and then read all my notes like 3 times and I'd be fine. But in optometry school, you kind of can't do that because you don't have the time. So I just like read my PowerPoints out loud, and that's the way I study, and Rema knows because I've studied with Rema before. But that's the best way that I study, is literally just like read the notes, have someone read it back to me, and we just go back and forth and talk about the information. And I think that's helped me a lot, and I know other people that study that way as well.
Yeah, so in undergrad, I always studied on my own. I never studied in groups, and that completely changed in optometry school. I would say you feel like there's not enough time to like sit down and rewrite your notes in optometry school, and studying in groups helped me so much, especially the first 2 years.
Yeah, I have to study in groups. I would study in groups in undergrad too, but even more so now.
Yeah.
Great. So we have a question from Selvin. I'm sorry if I mispronounce your name, but she said this is more for Rema, but what made you switch from medical school to optometry school?
So in undergrad, I shadowed a lot of specialties, and I thought I was gonna go into med school for sure. But I do have my cousins, I have some family members that are in med school or they graduated, but they never saw their family. They were always on call. Some of them who were residents would get like 3 hours of sleep. That's just not me. I can't function like that. And I feel like with optometry school, after undergrad, you just do 4 years and you're a doctor. And I shadowed a lot of different specialties, and when I shadowed an optometrist, I just fell in love with the profession. I loved how the optometrist had time to like sit down with the patient and listen to their concerns, and I didn't really see that with other specialties.
So this is a question that I have, but how important would you say having extracurriculars as a student studying optometry is?
Um, I mean, I had a few. I was like in the pre-optometry club. I did like a volunteer Rotary club. I was like in a Catholic club, and I had positions in all of them. But I feel like I don't know. Like I was such an average student, and I feel like if I didn't have all my extracurriculars plus like working in the field for so long, I don't know if I would have gotten in because I was really, really average. So I feel like leadership roles sometimes can like help you a little bit, but also like experience or shadowing hours too, that'll also help.
Yeah, I agree with that. I feel like being like in a club, for example, or having a leadership role can teach you a lot about like communication, working with other people, and I feel like that helped me a lot when getting into optometry school.
So we have a question from Nicole. She asked, what was the biggest difference going from undergrad to grad school?
You can go, Maryann.
Okay. The biggest difference I think would be just the amount of coursework, honestly, because like right now I'm in second year. Second year is supposed to be the hardest year, and honestly, we just started this quarter. We're in the second week, and I already feel behind because it's just like so much. We have like 9 classes and 3 labs, so that was like the number one thing that was like the biggest like difference. Because in undergrad, I would take like what 3 to 4, 5 classes, and that was it, including labs. Like barely. I don't think I ever did more than 7. But now in optometry school, it's like at least 7 classes with at least like 1 or 2 labs. So that was the biggest difference for me.
Yeah, I feel like I always felt behind. Now I don't have classes anymore and I'm done with boards, but when I was a second year or even a third year optometry student, I always felt behind. Like I felt like there's never going to be enough time for me to
Yeah.
finish all my studying. Yeah.
So we have another question from Aya. She said, do you have rotations?
Yeah, so that's what I'm doing right now. We have 4 rotations during 4th year. We rotate every 3 months. So I was in Connecticut for my first one. It was my primary care one. My second one was a specialty contact lens practice, and it was in Chicago. My third one right now is a disease practice, and it's in Nebraska. That's where I'm at right now. And my last one is at the school.
And then we have another question from Salvin. Again, I'm so sorry if I mispronounce your name, but how do you guys balance family, social life, and school and grad school due to the workload?
It's kind of hard to be honest, because it's like I make it a thing to call my mom at least every day, even if it's for like 5 minutes, just because like just so she doesn't think I forgot about her. But like literally sometimes I don't even have those like 5 minutes. Like I'll do it like if I'm like driving home from school or like whatever. But yeah, it's hard. You just have to kind of like put school first a little bit, but also remember like, oh, you still have a life, so like you got to see people too. But and I don't know. I don't really know how I balance it.
Yeah, I honestly just gave up on sleep.
Yeah, literally. It's so bad. Like last night, I was up till like 2 o'clock studying, and then I had class at 8. But then we had technical difficulties, so I didn't actually have class at 8. So it was nice to sleep in a little.
Yeah.
I feel that a little bit now because like I'll have my mom and she'll text me and she'll Snapchat me too and she'll be like, why are you ignoring me? And I'm like, I'm so oh, we have a question from Susan. She said, do you have any recommendations on how to find other shadowing opportunities or internships relating to optometry during undergrad?
I know that our school does Doesn't Midwestern do something in the summer for undergrad?
Yeah, it's called the C program, I think.
Yeah. So I know our school does it. I think other schools do it too. You can probably look into that like on our website is what I'm thinking. But also literally just call around optometry offices in your area and see if someone is willing to let you shadow, because that's what I did. Even though I worked for 5 years, like I saw like how different doctors practiced, and I saw like what I liked and what I didn't like. So that was cool because I worked for like a lot of doctors, but I also went to shadow doctors too, like that are in like contact lens specialty or like more that do disease, so that I see like what I like and what I don't like.
Yeah, I agree.
We have a question from Anna. She's asking, what would you all recommend to look for when looking at optometry schools?
Do you want to start, Remo?
Um, I would look for the class size. That's what I looked for sure. I feel like I like having a smaller class size because it feels more like a family when you're there. So that was really important to me. Because some schools will have a class size of 150 and some will have like a 50. So there is a difference there. I would look at the board scores. For us, we're new. It's a new school, so we don't have that information yet. But that's something else that I would look at for sure. So class size and board scores.
Yeah, that was something that I looked at too. And also, like, when you go for your interviews, or if you want to before you even apply, you can always like go and tour the schools. So I know, like, I was a reapplicant, so I applied the first time and I only got an interview at Midwestern. But when I got my interview at Midwestern, after I went to my interview, I was like, I know this is the school that I'm gonna go to, because not only did it have like the class size that I wanted, but it also had like newer equipment, and like everything is outdated because it's a new school. But also like just the building and the areas around it just reminded me of how it is at home, so I felt like very comfortable here too. So I feel like that's kind of important too, to find a place where you feel really comfortable at. um but yeah, we literally are like a family. There's only now we have 4 classes, but if you see this like Christmas picture, that was like at our ugly Christmas sweater party. And this is literally three three of the classes, because we didn't have the 4th class yet. But this is only like half of us. This isn't even all of us. But like we all know each other. Everyone's like super nice and friendly, and that's something to also look for. Like, I mean, it's optometry school. Like no one's gonna really be that competitive, but like it's nice to have a class or like people that will help you. So
Yeah.
That's awesome. That's a really cute picture too.
thanks.
So we have a question from Salvin again. How many schools did you guys apply to?
I applied, I think, to either 4 or 5 schools. I only interviewed at 2 though. Once I got an interview at Midwestern and I really liked it, I stopped responding to all the other schools.
Yeah, the first time I applied to 5. I only got an interview at Midwestern, but it was dumb of me because I didn't update my GPA on. I was supposed to update it on to send it straight to the school, and I updated it on OptumCast, and that's why I didn't get in the first time, because I would have gotten in the first time. But then the second time I applied, I only applied to Midwestern because I knew I wanted to go there, and I knew that was like the only mistake I had. But I also ended up retaking my OAT and doing better, so that I showed them that like I just didn't do anything in my gap year. And I also worked at an MD/OD office that year too, so I gained like a lot of experience during my gap year. But yeah, I applied to 5 schools and then 1.
All right, we're gonna take one more question and then I'm gonna do the closing statement so you guys can go on with your day. I know you're probably studying since you said you guys had a ton of studying to do. Well, I have a question to ask. How do you both feel that COVID impacted your studies? And were there certain things you wanted to pursue this year that had to be put on hold?
You can go first, Maryann.
Okay. So for us, COVID happened literally the second week of our third quarter. So I don't know if I explained this beforehand, but our school's on a quarter system. So we have like 3 quarters every year. Second year, you have 4 quarters. So you go through the summer. And then third year is the same way. I think you start fourth year in the summer, right, Rema?
Yep.
Yeah. So we're on a quarter system. So we got back from spring break. We had 1 week of class. And then the week later, it was COVID. We got sent home. Actually, we didn't get sent home because our school didn't actually close, but they just told us we're going to do like remote learning. So that was hard because like you're like, what are we supposed to do, you know? But it kind of helped me like learn how to study by myself a little bit because I was like always very dependent on other people. Like I would still like Zoom like my friends and we would study together all the time, but like it taught me how to study more so like by myself and like how I actually study instead of just like I don't know, like it was so busy. The only thing that I really didn't like about it was that we weren't able to go to the clinic or like the clinic and also the labs to practice, and we kept learning new skills. So it was like, when are we going to use this? Like when are we going to actually like go in and like learn this stuff? But we ended up doing it like when we came back to school, so it wasn't too bad. It was just hard.
Yeah, it didn't affect me or the fourth years as much, honestly, because we have rotations and we're just at different practices, so it didn't really affect me as much. We still got to do what we were planned to do.
All right, well, I want to thank you both so much for the incredible, insightful session. Rema and Maryann, I really enjoyed learning about optical fractures, and I hope to have a session with you guys in the future. If you would like